Welcome to The Explainer. Today, we're breaking down a really important 2026 clinical review from JAMA Internal Medicine. It takes a hard look at the complex relationship between cannabis and mental health. Our goal here is to cut through all the noise and get straight to the clinical evidence. What are the real benefits, the actual risks, and what does it all mean for treatment?
So, we all know that a lot of people use cannabis, often to self-medicate from mental health symptoms. And for years, the general idea that it's risky has been going down. But here's the big question. Does the clinical evidence actually back that up? This review gets right to the heart of that question. And frankly, the answers are pretty eye-opening.
All right, so what's the central problem that this review is really trying to get at? Well, it all boils down to what they call a growing clinical paradox. Basically, a huge disconnect between what the public is doing and what the science is showing.
You see, we've got these two powerful trends heading in completely opposite directions. On one hand, cannabis use is more common than ever, and the THC in today's products is incredibly potent, way stronger than it used to be. But at the exact same time, the scientific evidence pointing to potential mental health harms is getting stronger and stronger. So you have this major conflict between public perception and the data.
Okay, to really grasp the findings in this review, we first have to cover some of the basics. Let's talk a little bit about pharmacology and how these cannabinoids actually interact with our brains.
You know, the key difference really comes down to precision versus brute force. Our body has its own natural cannabinoid system, and it works like a surgeon's scalpel. It sends these very precise, localized signals right when they're needed to keep things in balance. THC from cannabis, on the other hand, is more like a sledgehammer. It just floods the entire brain, hitting all these receptors everywhere, which leads to those widespread and long-lasting effects on mood, memory, and everything else.
All right, with that background, let's dive into the core of the review. We're going to look at the evidence for specific psychiatric conditions, taking them one by one.
This matrix gives you the whole story in a single snapshot. On the horizontal axis, you have the strength of evidence for any benefit. On the vertical axis, you have the risk of harm. Now, just look where almost all the data points are clustered, right down in that bottom left corner. That means, for most conditions, there's insufficient evidence of benefit, but there is a measurable degree of risk. Now let's zoom in on a couple of specific conditions. For PTSD, the evidence suggests cannabis doesn't reduce symptoms any better than a placebo. For anxiety, things are a little more complex. THC can be pretty unpredictable, sometimes helping, sometimes making things worse. But there is a small glimmer of potential in some emerging studies on pure CBD. That is, CBD without any THC, which might offer some relief for certain anxiety disorders.
And this is where we see what looks like a classic self-medication trap. For depression, there's no clear link to improved symptoms. And even more concerning, there's a critical risk. Heavy use is tied to a significantly higher risk of self-harm and suicidality. Then for ADHD, despite what you might hear, the clinical trials show no therapeutic benefit. In fact, being intoxicated with cannabis can actually mimic the very deficits seen in ADHD.
When we get to bipolar disorder, the evidence becomes incredibly clear-cut and, frankly, quite alarming. The data consistently shows that cannabis use, particularly high THC products, doesn't just fail to help, it actively makes symptoms worse. We're talking more severe mania, more psychosis. So the clinical guidance here is unmistakable. Patients with bipolar disorder should be strongly advised to stay away from it.
And for psychotic spectrum disorders, the data shows a really clear progression of risk. Acute THC intoxication can trigger temporary psychosis, but with repeated, frequent use, especially during adolescent brain development, the risk of developing a chronic disorder like schizophrenia just skyrockets. We're talking anywhere from a 2-fold to as much as an 11-fold increased risk.
So, beyond these specific disorders, the review also highlights two other major areas of harm that really apply across the board: cognitive impairment and a high risk of addiction.
First, let's just land on this number for a second. Addiction. The review points to a pretty startling statistic. Nearly 1 in 3 people who've used cannabis in the last year meet the clinical diagnostic criteria for cannabis use disorder, or CUD.
And this slide really breaks down those two big risks. On one side, you have the neurocognitive effects. We're talking immediate problems with memory and executive function. And for teens with heavy use, there's even a risk of potential drops in IQ. Then on the other side, you see the reality of cannabis use disorder. Not only is it common, but for about half of those diagnosed, it's moderate to severe. And here's the kicker. There are currently no FDA-approved medications to treat it.
So, with this mountain of evidence,
what's the next step? What does this mean for patients and the doctors who treat them? Well, the review provides some very clear, actionable guidance.
The review lays out a simple 3-step framework for clinicians. It starts with just asking, routine non-judgmental screening to get the conversation started. Step 2 is absolutely crucial. Try to quantify how much THC a patient is using and specifically warn them about high-potency products which have no proven extra benefit but carry extreme risk. And finally, and this part is key, clinicians need to educate patients about withdrawal so that symptoms like anxiety or irritability aren't mistaken for their original condition coming back, which just creates a vicious cycle.
And this is so important to understand, cannabis is not a benign substance when you're taking other medications. This table shows how THC and CBD can mess with the enzymes that process common drugs. The clinical consequences are serious. We're talking increased levels of antidepressants, much higher sedation with benzodiazepines, and increased opioid levels in the blood. These all require very careful management.
So all of this evidence leads to a clear set of strict contraindications. These are the groups for whom cannabis use is just not recommended because of the elevated risk of severe harm. This includes adolescents, whose brains are still developing and are uniquely vulnerable. It also includes patients with existing bipolar or psychotic disorders, where we know it can make things worse. The warning also extends to pregnant individuals and anyone with a past substance use disorder, given their higher risk of addiction. All right, let's wrap this up. What is the final, unambiguous take-home message from this massive and comprehensive clinical review?
So here it is, the bottom line. The current clinical evidence does not support using cannabis to treat mental health conditions. In fact, for many people, the risks, from making mania worse to triggering psychosis, far outweigh any of the unproven benefits. The review is really a call to action for clinicians to prioritize patient safety by screening for cannabis use and counseling people on the very real dangers of high-potency THC. And that leaves us with a critical question. In an age of legalization and widespread acceptance, how do we close this dangerous gap between what people believe and what the science actually tells us?